The computer model used by state and federal officials that once showed Arizona with hospital bed shortages and more than 1,500 deaths now shows the state is projected to endure 570 deaths. Obviously, much more hopeful news, but how did this change so fast in 1 week? With me now is ABC 15's data guru, Garrett Archer, to help us walk through these numbers. And Garrett, why the drastic change within 1 week?
Hi, Katie. Well, the IMHE, the group that's responsible for this model, has put a lot of more data into this model in the last week or so. And so what they're doing is they're using data from the state that they're now feeding into the model to make the projections. And because our numbers have been significantly lower than places like New York, our projections for hospital beds, ICUs, are all much lower than they used to be.
So I know it's so important to look at several models as we've been tracking across the state. How much stock should we then put into these computer models that we've been watching so closely?
Well, this is a good model. It is holding up in New York. Now, that's obviously it's sort of morbid for New York, but it is holding up. The problem with some of these models that we have to consider is that it's only as good as the data coming in. So the model is using the data that we are sending over to them, that the ADHS is sending to them. And so if the only way that this model is truly accurate is if the ADHS is confident in the amount of testing that they are doing, and that the number of testing that they're doing is reflective of the number of hospital beds and people that need treatment for COVID is reliable.
Yeah, one of the numbers that we saw change was not to have a shortage in hospital beds. Could we see that go back again where we would be short?
So absolutely. So as this data is getting modeled now ingested daily, something that it wasn't before when it was showing much higher projections, if for some reason Arizona changes its testing model or begins to do some more testing of people that are in hospitals that otherwise may not have been tested in the weeks prior, we're going to start seeing those numbers go up, and that will be reflected in the model. They will readjust that model. So we can be hopeful that that model is correct, but only if the Department of Health is confident in their own numbers.
And only if we act as well, if I'm not mistaken. We have to keep social distancing. We have to be going by the CDC's recommendations, wearing masks in public, things like this. We play a crucial role in these numbers.
Yes, this model, one of the reasons that this model is being utilized so heavily by the federal and state officials is that it takes into account the social distancing measures that everyone's putting into place. So now that a lot of these social distancing measures are uniform across the country, that's why a lot of these numbers are changing. Prior to all of these social distancing measures, they were using the models from Italy and from China, where the numbers were just so much larger because the models had not considered the social distancing yet. So these do. So that is encouraging.
Yeah, for sure. Garrett, thank you so much working
Absolutely.
from home for us tonight.
Sure, no problem. Thank you.